Welcome to the Aesthetics Mastery Show. The show that's supposed to help you raise the bar and thrive in your aesthetics career is actually helping you survive in the NHS at the moment because we are all gripped by this global pandemic. Many of our colleagues are rushing back to help, as am I, starting on Wednesday, to be on the front line and chip in to do what we can to help the NHS in this difficult time. So today we're not talking a lot about aesthetics, but what are we talking about, Miranda?
Okay, so we're talking about PPE because this is the topic that everyone is talking about, namely because actually it's whether or not when you go back to the front line, you're going to be safe. Because it's one thing doing your job and helping out, and it's another thing thinking, well, actually, am I going to fall victim to this horrible virus? So from my perspective, it just kind of seems mad to me that in this very first world country, we must be in amongst one of the richest countries in the world. How are we not able to supply our health workers with the basic PPE?
Well, it's a controversial topic because many people believe that they have got the correct PPE, while others still believe that they haven't. And it's down to what's basically not a binary issue. It's not black and white, what is safe. There is an assessment that what they're being given is safe enough in most cases. Now, there are shortages of it. That's a whole different thing. But in terms of what's actually been prescribed, the type of protective wear, there's a debate to be had. Many people believe that it is actually correct.
Well, we were talking to our friend Beatrice, who is a doctor in Hong Kong the other day, and she was seeming to describe that everyone had like hazmat suits and the whole shebang. So, and then in my head, I thought, well, that sounds like that's a big part of the reason why they've managed to keep great control of it in Hong Kong. I think there were only 140 cases or something crazy. So am I right? Is it as simple as the more protected you are, the less likely it is to spread amongst colleagues?
Well, like any intervention, there is what achieves most of the benefit might be less than what you could potentially do. It's a little bit like that with any treatment or any intervention, that you can do the full hog and spend £1 million trying to solve a problem, or you can pretty much get 95% of the way and solve 95% of the problem for £100,000. It's that kind of equation that always makes it difficult. So I don't think there's any doubt that if every single practitioner was wearing an N95 mask or the FPP3 mask, which is the equivalent, that there would be a reduction in the number of cases of spread. But I think the equation at the moment is that for the difference, it wouldn't actually be worth it.
So help me out. Like, what are those two things?
Well, these are surgical masks, which are what you see most people wearing on the street. If you're if you go around Hong Kong, it's normal for members of the public to wear this. This is what I will have get supplied to me when I'm back on the front line in general practice. So I have to say, when I use the word front line, I do not compare myself with these people on wards where they're just looking after COVID patients. Those people, I'm pretty sure, are not being provided with just these masks. They'll be using respirators, but this is where it gets complex. So the thing with this is not a filter for air. It's not designed to stop bugs getting in. It's actually mainly designed to stop your bugs getting onto patients. And that's the first thing to understand about this, is people who are wearing these, it might help you from someone spitting in your face. So in this direction, in this proximity that we're in now, if you were wearing this and I was speaking to you, this might protect you from getting sick. But if you're wearing it out in the supermarket, believing that the air that you're breathing in is going to be somehow filtered, well, you're wasting your time. And I think that's where people get confused. This is not an air filter, it's a barrier. That's the best way to think about it. It does a degree of filtering like anything, but think of it more as a barrier. And that also depends on how you think these viruses are spread. And this is where there's another possibly false dichotomy, which is they are described as either airborne or droplet spread. And droplets are basically visible drops of saliva that come out of your mouth when you cough, and you can see them go pew, and they may be blown a little bit, but they think they're about at 1 to 2 meters that they can spread. And then aerosols. So some viruses do live, very well-known viruses, and basically live in the air and float around for hours. Probably the best example is measles. So measles can float in the air for many hours. So if you get into a lift after an elevator, after someone's gone in there, an hour afterwards, you can get sick, which is why the average person who has measles in an unvaccinated population will infect 17 other people. So because it's so easy to spread, whereas most of the viral infections that are more droplet spread infect far fewer people because the droplet doesn't live in the air that long. Now, my understanding is that the tricky bit is, does that mean that if you wear something that is something that will defend you from a droplet, that it's impossible that you don't get a small amount of an aerosoled, basically effectively aerosoled amount of the virus in through the side of your mask? And the answer is, of course not. Of course that happens too. These are not black and white things. All these viruses have different sizes. They're on a spectrum. There isn't a line that magically the virus knows, oh, sorry, I'm not supposed to be a droplet, I'm supposed to be an aerosol, or vice versa. There is a bell curve of spread. So it's made to be a black and white issue because that makes it so much easier to handle. But the truth is that there will be cases of people inhaling this virus from people who've just coughed maybe 5 minutes before, haven't spat on their face, but there are enough of these little droplets. I saw one Japanese study they're starting to call them micro droplets. So something in between droplet and aerosol is a micro droplet. And effectively, you can watch them using a laser. You can literally watch these droplets after a big cough. You see the big droplets dive to the floor, and you see the other droplets just drift over, and basically in a big cloud of tiny micro droplets, they do spread across the room. Now, there will be a lower dose on those, and they aren't as dangerous as a big dose of droplet covered in virus, but it's still possible. And I think this is where all the controversy comes, is we're desperate to be black and white and say this is the right mask and this is not the right mask. And the truth is, actually, none of them give you 100% protection. They just give you an increasing amount of protection. And none of them are useless either. They all do something. But that's where it gets really tricky.
So, for example, we got given one of these by my colleague who had gone to Romania, and he bought a couple and gave us a couple. So I went to the supermarket with this a couple of days ago. So that's for something that could, just around and about. Also, you're going to use this in general practice. When would you, and this is actually from your DIY, isn't it? You just have this in your shed. So when would you start to use this?
So the current guidelines are that if you're in front of a suspectedly infected patient, so if I see someone in accident emergency with chest pain who got it on exertion, so we're not suspecting it's a COVID infection, then you might not wear that. You might just wear one of these masks, which is actually primarily protecting you from spitting on the patient and might protect them from spitting directly onto your lip or something like that. But you wouldn't wear one of these. And there are reasons that might be good, because like anything, it's more complex in reality. Because reality is, if you've got a tight-fitting mask on all shift and you don't need to, that's going to make your shift harder. It's going to make you touch your face more often. There are downsides to masks as well, which is why we also currently don't recommend the public wear them in this country, although they do in other countries, because of this touching of faces.
So I shouldn't have gone to the supermarket with that?
Probably not. No, that's not the advice. So it's more that people feel safer wearing them. That's one of the reasons. And when I say probably not, that's according to our government's advice. If you live in a different country, they do advise you. I think one of the interesting philosophical things that's happening is that I think in the Western world, we have a slant towards the individual protecting themselves. And I think in other countries, there's a bit more emphasis on you better do this to protect the people around you. Because I think that's the best reason to wear a mask, is probably that if, in case you're in the early stages of it, you're not coughing everywhere and infecting more people. It's not as effective preventing you from getting it from other people who are coughing near you, which is why I think if you're a GP, personally, my feeling about these masks is the best person to have it on is your patient that you don't know yet what they've got. They should all be wearing it. But I tell you what we're shorter of than masks is GPs, nurses, doctors. They need to be protected, because when you run out of those, who cares about masks? I think one of the interesting things about this whole debate is 3 weeks ago, you could have made a much more solid argument why it's not worth spending, having the most expensive mask, because we knew the numbers were small, but they're growing so fast that if you've been tripling, doubling, or 2.5 times sometimes what the numbers are every 5 days, suddenly in your community, you've now got many more times people with the illness. So it makes sense to increase the amount of protective gear you have the more common the virus gets. So it depends on the timing as well, because, as we knew maybe back in January, there probably wasn't any point even wearing a surgical mask, because all the coughs and colds you were seeing were almost certainly not coronavirus. So that's all different now. Like as this wave, and it feels, for those of us monitoring all the time, it feels like a tsunami heading our way. Then it makes sense. You want to be prepared for it. So we should be wearing masks.
And my inbox, because everyone knows that I'm into mindset, and so people kind of turn to me for more of the emotional support. My inbox is blowing up, and one of the things that people are feeling is anger. Like, why the hell are we not being protected? I'm being asked to go into battle without armor.
Mm-hmm. Well, it's a very valid question, because when you actually look at global pandemics, it's not something that we could have predicted. It's actually just inevitable. It's way more than something you could predict. They are going to happen every so often. We know they're going to happen. And we know that they're going to sweep the world because we're so well connected. There's nothing actually surprising that's happening right now. We didn't know when. That's the surprise. That was this year and not in 5 years' time. But actually, there is a damn good argument to say we should have been prepared for this. There should have been stockpiles of basic protective equipment for healthcare workers. Absolutely. To suddenly then try and buy it when the whole world's trying to buy it, that's a failure. And I don't think we will ever make that mistake again. I think you'll find that we will suddenly next time have stockpiles of these basics, because it's you shouldn't have to scrabble around at the last minute. There's also possibly the fact that the government had a different strategy initially. They were going more for this herd immunity strategy, which is basically let people get sick, hope you can control the rate that they get sick.
Let the well people get sick.
Yeah, so the herd immunity strategy is that you control who gets sick, and you control the rate that they get sick, and you protect the weak people. So if you're over 70, you hide away, and if you're not, you take basic precautions, but you carry on with your normal life. And I think what they realized when they looked at Italy and when they were looking at their own numbers, it was growing so fast and the number of sick people was so high that they had to change strategy and go into lockdown.
Let's talk about that fear, like that dread, that moment where you wake up at 3 a.m. thinking, oh my God, like I'm putting myself at risk. Is this even worth, like I should just quit and just go and live on an island or something, like as far away as I can get. How do you deal with that kind of emotion?
I personally swing between the two of, because I do have the option of not going and not being involved at all. But especially when you see colleagues die, like it's Adel Al-Tahar, who was an ENT, he's an organ transplant specialist who was volunteering in an A&E department who caught it, 63, died on Wednesday. And there is also another consultant, Amjad Al-Harani. So he's also passed away. His 18-year-old son gave a lovely tribute to him, but he looks younger than 63. I don't see his age. But these are guys that I really relate to. I was trained by people like that, and it's you don't want to. I want to be involved somehow. I want to be taking some strain from the whole system. And I know I'm currently not going to be really front line, but it's all, I feel like you want to be with your tribe as they go through these things.
Mm-hmm. So if you've made the decision, because it sounds like that's what's helped you make that decision, is that you just want to help in whatever way you can. So let's say you made the decision, or the decision is kind of made for you because you've got to put bread on the table and you're in contract, etc. You can't just go and hide. How then do we manage our emotions if we are feeling the dread that we're going to pass it on to our children and our loved ones, and we might have, how do we manage that?
Well, I'll be honest, I don't actually worry about passing it on to my children. As I think I've said before, I'd be more worried about passing it on to you. So you've just got to take all the precautions that you can. I mean, I would take some certainty from the fact that actually, well, here's a way that just popped into my head, is that you might actually be saving your loved one in an indirect way by going to work and chipping away at the number of people who get infected and pass it on. So if you're at work and the NHS isn't crumbling and your particular hospital doesn't shut its doors to new patients because there are so many, and those patients therefore can keep being seen in the hospital rather than dying in the community, I might actually indirectly stop you from getting it at ASDA in a year's time because I went to work and helped a little bit in the system. So you may not be protecting your family by not going forward. It's a lot like a war. That's how it feels to me. Like it is, you can hide or you can go and take a risk personally, but in the long run, you're doing it for everyone around you.
Mm-hmm.
So that's one way of offsetting it. And then if you accept that, then the next thing is you just got to focus on what you have got control over. So, I'm already thinking about how I'm going to lay out my room. I'm buying some scrubs, so I won't wear the same clothes back home. Those sort of things help you feel more in control. And it has actually right now, because you've asked me that question, it's helped me to realize that that you indirectly are decreasing the risk for everyone. So that includes your family. So the right thing for your family might be to take a risk.
Mm-hmm. But when you are in that moment at 3 a.m. and you've sat up, bolt upright, thinking, oh my God, like, I just don't know whether I can do this. Like, this is a level of anxiety that would probably normally see people off, sick with mental health issues. But you've made the decision you're going to go in. How do we help with our own mental health around this?
One of the things that I've realized with my own anxiety over various things is that it's not okay to dwell on stuff that makes you feel awful. Like,
sounds obvious, but
yeah. But your brain will take you there. It constantly wants you to resolve the issue. So it takes you back to the uncertain situation. And then unfortunately, for some reason, what we tend to do is, instead of plot out practical things we can do to keep ourselves safe, we instead play ourselves the impact of the problem over and over in our head and usually exacerbate it. So, not only will something bad happen, but there'll be knock-on effects of that bad thing happening, and everything will, you can almost create the worst possible scenario out of even small threats.
Catastrophizing.
Catastrophizing. If you have a good imagination, you can ruin yourself with it. So you need to, as quickly as possible, realize that it's not okay to feel anxious about this in this way. Like, I mean, some people may not agree with this, but actually, I have to reject anxiety. Mm-hmm. I haven't had real anxiety for a long time, but I've had it in the past badly enough that I've learned that I cannot allow myself to go there. It's almost like it's like learning to snowboard. I remember when I was learning to snowboard that if you caught the edge on the board, you'd fall. It would hurt. And I quickly realized the association of leaning forward made me feel scared. And I would stop myself from leaning forward because that was what was tripping me up. And it's a bit like that with anxiety. I've learned those initial feelings when you start to weigh up a problem, you have to knock it on the head straight away. Because if you allow yourself to go in there and explore that, you can start a cycle. It's a bit like a fire where you're just ruminating, going round and round in circles, playing out the worst case scenario and feeling awful and not actually achieving anything. Anxiety is sometimes a bigger threat than even COVID-19, because you might be one of the most 85% of people, or probably a lot more, who basically have fairly mild symptoms. And meanwhile, you can make yourself horribly anxious and very, very unwell and suffer when through not being able to control your thoughts and focus on the right things.
I think that's such an important point. And this goes back to our society. We don't look at mental health as much as physical health. And we absolutely need to. And that's such a good point. You could screw yourself with your anxiety more than COVID could. And that might sound a little bit insensitive, so it's all right for you to say you're not on the front line, but actually I do see that as a genuine threat. And that thought alone might help people watching this to actually say, no, this is not acceptable. I'm looping.
I'm going to say something slightly controversial, which is, I think our society actually talks about mental health a lot, but they talk about it as if it's something out of people's control. And they talk about it as if it's something that happens to you through no fault of your own. And my experience is you can do it to yourself. And I actually think most people do it to themselves. Now, that's a very controversial thing to say, but I've been down this route myself of focusing for so long on something that was really awful that I couldn't control and getting caught in a loop and actually doing it partly out of choice and actually ending up feeling that way because I didn't learn how to control it. So as soon as you can control it, you realize it's a choice, and we can't make everyone a victim of it. We must be kind to people and support them, but actually there's part of them that needs to say, you know what, I'm gonna have to change what I'm doing here, or it's never going to stop. Mm-hmm. So it's complex because I still think you can think your way in and out of it, but you have to accept that you're in control before you do that.
Well, I mean, this topic is just absolutely mega. We'll definitely, in fact, we've got plans to explode this topic out, haven't we? So keep watching for more and more on this. But I hope that's given you guys enough to at least challenge your thoughts around it.
So what do you think? What do you think about the PPE situation in the NHS, and what do you think about mental health confronting this uncertainty as a nation and as a healthcare provider? Drop us a note in the comments. We'd love to hear your thoughts, and stay tuned for our next show, which should be in about a week's time.
Take care.